From coast to coast, breakthrough infections are climbing and more vaccinated people are ending up in the hospital with COVID.
Health officials telling our Brian Munoz that does not mean the vaccines are not working. It just means they say more people need to get the vaccines.
Data in a number of states suggest breakthrough infections are climbing. And right here in the mid-state, that is exactly what is happening. Breakthrough infections, which happen when vaccinated people test positive for COVID, are becoming more and more common. And in Lancaster County, so are breakthrough hospitalizations, worrying some experts that vaccine immunity may be starting to wane.
The CDC was saying that at some point we would need a vaccine booster. What we were waiting for is some solid data to tell us when.
Nearly 23% of COVID patients at Lancaster General Health are vaccinated, up from 15% 10 days ago. WellSpan Health reports similar trends across its hospitals.
Pretty typical for what's going on around the country. But if you look at the number of people in the ICU, that percentage is much lower. And if you look at the number of vaccinated people who actually die from COVID, that number is extremely small. And that gives you the benefit of the vaccine.
But Dr. Concha says this doesn't point to a failure of science, just the reality that no vaccine is 100% effective. The bottom line on vaccines is simple.
It's much more effective at preventing severe disease, hospitalization, and death than it is at preventing infection in general. And that was the expected outcome of the vaccine from the beginning.
Dr. Contra adds, if you're eligible for a booster, get one when the time comes, because that'll help protect you further. In Lancaster, Brian Munoz, ABC 27 News.